It usually starts with something small, a little fatigue, a bruise that won't fade, a nagging cough. Most people over 60 shrug it off, saying, it's just part of getting older. But what if that small, annoying symptom is actually your body's early cry for help? What if it's warning you about something serious, something life-threatening, long before you feel truly sick? Because here's the truth, millions of seniors ignore these red flags every year. And far too many of them never get the chance to act before it's too late. If you're over 60, or love someone who is, don't make that mistake. In this video, you'll discover 7 medical warning signs that too many people brush off, until it's too late to do anything about them. Every single one is backed by real stories and real consequences. So please, stay with me. Like, share, and subscribe so more people can avoid these silent dangers. Someone you care about might need this more than you think. Irma was 68. She wasn't slowing down, not the way people expected at her age. Every morning, she was up at sunrise, pulling weeds, watering her garden, chatting with neighbors as they walked by. She baked for the local church fundraiser. Still drove herself everywhere. Still laughed like a woman half her age. But a few months ago, something shifted. Her clothes started feeling loose. At first, she thought it was just a little weight loss, maybe from skipping lunch now and then. But soon she stopped wanting food altogether. Her energy dropped. And that smile everyone loved? It faded. Her daughter begged her to see a doctor. But Irma said, I'm just getting older. I'll be fine. 6 months later, Irma was diagnosed with stage 4 pancreatic cancer. It had spread too far, too fast. There was nothing they could do. All those little signs, the appetite loss, the fatigue, the weight drop, they weren't harmless. They were loud, blaring signals from her body. And she didn't know how to listen. Now here's the truth, Irma's story isn't rare. In fact, it's far too common. Many seniors brush off real medical warnings, blaming them on age, on stress, on just a little tiredness. But your body talks to you. And if you don't speak its language, you might miss the message that matters most. This video isn't about fear. It's about power. Because when you know what to look for, you can stop tragedy before it starts. Let Irma's story be a warning, not a prophecy. Warning sign 1. Unexplained weight loss. Losing weight without trying might sound like a dream, especially in a world where so many people struggle to shed pounds. But after 60, when your body starts dropping weight for no clear reason, that dream can quickly turn into a nightmare. You're eating the same. Your daily habits haven't changed. And yet, your pants feel looser. Your belt needs a new hole. People start asking, have you lost weight? And you're not even sure how to answer. It's tempting to shrug and smile. But the truth is, unintentional weight loss is one of the biggest red flags your body can wave. It could mean your thyroid is overactive, speeding up your metabolism and putting dangerous stress on your heart. It could be a sign of type 2 diabetes, a condition that's often missed in older adults until serious complications begin. Or worse, it could point to a growing cancer, silently spreading before any pain ever shows up. Irma, who you met earlier, thought she was just getting healthy. She figured her appetite was shrinking because she was slowing down. But that slow fade was her body telling her something was deeply wrong. By the time she paid attention, the damage was already done. Here's the key, after 60, weight loss should never be ignored. Even if it feels like a blessing. Even if it's just a few pounds. Your metabolism naturally slows with age, so sudden drops in weight aren't normal. And it's not just about the number on the scale. It's how you feel. Do your rings slide off more easily? Are your cheeks looking sunken? Have your clothes started hanging differently on your body? These subtle shifts matter. That's why, if you notice this happening, even over a few weeks, talk to your doctor. Get your blood work done. Ask the hard questions. Because catching the cause early could mean the difference between a simple treatment and a life-threatening diagnosis. Have you or someone you know experienced this? Share below, your story could help someone else speak up in time. But what about the warning sign that doesn't show up in your weight, but in your voice? You might sound different before anything even shows up on a scan. Let's talk about that next. Warning sign number 2, hoarseness or persistent cough. A raspy voice isn't always just allergies. It's not always a cold. And it's definitely not something to ignore when it lingers. Imagine this, you're talking to an old friend on the phone. They pause and say, "Hey, are you okay? You sound sick. But you don't feel sick. No fever. No congestion. Just that scratchy, rough voice that's been hanging around for weeks." You tell yourself it's the weather. Or maybe the air's been dry. But if your voice has changed, if it's hoarse, strained, or keeps cracking, and it sticks around for more than 3 weeks, your body might be trying to tell you something serious. Persistent hoarseness can be an early sign of vocal cord issues, chronic acid reflux silently damaging your throat, or even early-stage lung cancer, especially in older adults. And here's what makes it so tricky: there's no pain. No dramatic symptom. Just that one nagging change. That's why so many people overlook it. They think, "I'll wait and see if it clears up." And while they wait, a silent condition progresses. In one study, a group of patients with hoarseness lasting over a month were later found to have tumors near their voice box or lungs, most of which could have been treated earlier if someone had just listened to that quiet warning. Think about your own experience. Have you ever had a cough that wouldn't quit? Or found your voice getting weaker or raspier over time? If it's been more than 3 weeks, that's not normal. And especially after 60, your voice deserves to be heard, literally. Talk to your doctor. Request a laryngoscopy or imaging if needed. Don't accept it's probably nothing as an answer. Would you wait weeks to get this checked, or do you act fast? Let's hear your take in the comments. Because the next warning sign we're covering? It shows up quietly. When you're just standing still. And it's one of the most overlooked symptoms that predicts heart failure. Warning sign number 3, chronic fatigue. You know the difference between being tired and being exhausted. We've all felt the occasional tiredness after a busy week, but what we're talking about here is something deeper. Bone-deep exhaustion that sleep doesn't fix. It's the kind of fatigue that hits after a short walk, and leaves you unable to do the things you once loved. You nap after just a few hours out, and still wake up feeling like you could sleep for days. This isn't just feeling tired. This is your body telling you something is wrong, and it's not just about needing more rest. Chronic fatigue is often linked to serious conditions like heart failure, depression, cancer, and autoimmune diseases. And if you're over 60, this warning sign can sometimes slip under the radar, because we expect to slow down with age. But Irma, who you met earlier, remember her? She had chronic fatigue long before she realized it was a serious warning sign. She thought it was just part of getting older. After all, she was still active, gardening, baking, even helping at the community center. But soon, even simple tasks felt impossible. She couldn't get through a walk without needing to nap. Her hobbies lost their spark, and she started isolating herself because everything felt like too much. What she didn't know was that her body was already signaling that something was terribly wrong. By the time her diagnosis came, it was too late to undo the damage. This isn't just about being tired, this is about being worn out in a way that doesn't make sense. If a short walk leaves you needing hours of recovery, if you find yourself sitting out of activities you once loved, your body could be struggling with something much more serious. Here's the kicker: chronic fatigue doesn't always come with obvious signs of illness. There's no fever, no cough, no visible swelling. It just quietly takes over your life, slowly draining your energy, until it feels like you've lost control of your own body. If your body feels like it's giving up, don't you owe it a second opinion? Chronic fatigue isn't something you just get used to. It's your body asking for help. So, if you've been feeling like this lately, it's time to see your doctor. A simple blood test, a heart check, or even an autoimmune screen could be the key to uncovering a hidden issue. Please, don't ignore it, and don't wait for it to get worse. If you've experienced this feeling, share your story in the comments. You might help someone realize it's time for them to get checked too. And speaking of silent warning signs, there's one more we need to talk about. It often starts with a cough. But not the kind you'd expect. Warning sign number 4, shortness of breath. You used to take the stairs without thinking. One step after another, no pause, no problem. But now? You find yourself needing to stop halfway, catch your breath after just a few steps. It's easy to dismiss it, just getting older, you tell yourself. That could be a dangerous mistake. Struggling to breathe, whether while climbing stairs, walking around, or even talking, isn't just a sign of age. It's a warning bell, and it's loud. Shortness of breath could indicate heart disease, anemia, or lung problems, all of which become more common as we age. But the problem is, many people misinterpret this symptom as just a normal part of aging. They think, I'm just not as young as I used to be. But your body isn't giving up on you, it's trying to tell you something. In fact, when we experience breathlessness, it can often mean the heart is struggling to pump enough blood through the body. This can be a sign of heart disease, which, if left unchecked, can lead to serious complications like heart failure. Irma, remember her? Before her diagnosis, she experienced shortness of breath for months. She found herself out of breath after gardening or walking the dog. But she shrugged it off. She thought, I'm just getting older. I need to pace myself. But that was a dangerous misjudgment. When she finally saw her doctor, they found her heart was weakening. She had been ignoring a serious problem that had been building up over time. Here's why you need to pay attention to shortness of breath. It could also point to anemia, a condition where your blood doesn't have enough red blood cells to carry oxygen to your organs. And if left untreated, anemia can lead to serious heart problems, among other issues. If you're noticing a consistent shortness of breath, whether it's climbing stairs, walking around the block, or even just talking, don't wait. Don't accept it as just getting older. Get it checked out. Your lungs, your heart, and your body need to work together to keep you feeling good. And if one of these systems is struggling, you need to address it early. Don't let shortness of breath become the norm for you. Because there's one more symptom that can show up in your legs, and if you ignore it, it could be deadly. Warning sign number 5, swelling in the legs or ankles. At first, it doesn't seem like a big deal. Your feet feel a little tight. Your ankles seem puffier than usual. Maybe your socks leave an imprint in your skin, or your shoes feel a little snug in the evening. But swelling, especially in the legs or ankles, can be a sign of something much more serious. It's not just the result of standing too long or being on your feet all day. This fluid buildup, often referred to as edema, could mean your heart is struggling to do its job. When the heart can't pump blood effectively, fluid begins to pool in the lower parts of your body, like your legs and ankles, leading to that uncomfortable puffiness. This is a hallmark symptom of congestive heart failure, a condition that affects millions of seniors. And it's often accompanied by other red flags, like shortness of breath and fatigue, signs we've already talked about. But it's not just the heart that could be the issue. Swelling in the legs or ankles can also be a sign of kidney dysfunction, which can interfere with the body's ability to regulate fluids properly. Irma, remember her story? Before her diagnosis, she started noticing swelling in her legs, especially by the end of the day. Her ankles were noticeably puffier, and she had a hard time getting her shoes on in the evening. But she didn't think much of it. She figured it was just part of getting older, maybe from all the gardening she'd been doing. But when the swelling didn't go away, and when it got worse, she finally went to the doctor. What she didn't know was that this was a key warning sign of her heart's decline. Her condition had been progressing slowly, and the swelling was one of the first clear signals that her heart was struggling. So, how do you know if swelling is something you should be concerned about? If you find that your shoes are feeling tighter by the end of the day, or if you notice an imprint from your socks that lingers longer than it should, it's time to take it seriously. Especially if you've already been feeling other symptoms, like breathlessness or fatigue. These are all interconnected. Swelling in the legs or ankles can also point to other conditions like blood clots or liver disease. But heart failure is one of the most common causes. If you're experiencing this, don't wait. Get checked out. A simple test can help determine if your heart, kidneys, or another organ is struggling. Have you noticed this change recently? Drop a yes or no below. It could be a reminder to someone else to get checked. Warning sign number 6, confusion or memory loss. It's more than just forgetting where you left your keys. We've all had those moments, the occasional "where did I put my glasses?" or "what was I about to do again?" But when forgetfulness becomes more frequent, it's no longer just a minor inconvenience. If you find yourself telling the same story twice in one conversation, or forgetting how to do things you've done for years, like making coffee or getting dressed, it could be a warning sign. Confusion and memory loss often get brushed off as normal aging. But here's the truth, they can be signs of something far more serious. Early Alzheimer's, strokes, and even certain medication side effects can cause memory problems. And the scary part is that these conditions often progress quietly, without much noticeable change at first. Irma's story brings this to life. She had always been sharp. She could remember every birthday, every recipe, every phone number without a second thought. But one morning, she walked into her kitchen and forgot how to make coffee. She didn't just forget the steps, she had to ask her husband how to use the coffee maker, something she'd done without thinking for years. At first, she laughed it off. Maybe she was just distracted, she thought. But soon, the forgetfulness became more frequent. She'd tell the same story twice in a single conversation, lose track of what she was saying in the middle of a sentence. Her family was concerned, but Irma brushed it off. After all, everyone forgets things from time to time, right? When the confusion became more pronounced, she realized something wasn't right. A doctor's visit revealed early signs of Alzheimer's disease, a condition that was slowly taking over her cognitive functions. It could have been managed more effectively if it had been caught sooner. So, how do you tell the difference between simple forgetfulness and a serious warning sign? It's all about consistency. If you're forgetting things occasionally, like where you put your keys or what you plan to do that day, that's normal. But if the forgetfulness starts affecting your daily life, forgetting how to do tasks you've done for years, repeating yourself in conversations, or getting confused in familiar environments, this is when you need to pay attention. Memory problems are a sign that something's not working as it should. It could be a sign of early Alzheimer's, a stroke that's affecting your brain, or side effects from medications. If you're noticing more confusion than usual, talk to your doctor. There are early interventions that can slow the progression of conditions like Alzheimer's, and getting a diagnosis early can make all the difference. How do you personally tell the difference between forgetfulness and a warning sign? Drop a comment below and share your experience. It could help someone else catch a warning sign early. And stay tuned, because there's one more warning sign that might be hiding in plain sight, and it's a problem you can't afford to ignore. Warning sign number 7, changes in bowel habits. It's not fun to talk about. In fact, many people shy away from even mentioning it. But your toilet habits? They reveal more about your health than you might think. Changes in your bowel habits can be a warning sign of serious health issues, including colon cancer, gastrointestinal problems, or dietary imbalances. And if you're over 60, this is something you can't afford to ignore. If you notice blood in your stool, persistent constipation or diarrhea, or if your stools start to look thinner than usual, it's time to pay attention. These could be early signs of something more serious, something that, if caught early, can be treated effectively. Irma, remember her? She always considered herself pretty healthy for her age. But one day, she started noticing blood when she used the bathroom. She was too embarrassed to talk about it, thinking it was nothing. Maybe she had eaten something bad, she thought. But when the symptoms didn't go away, and when her bowel movements started to change again, she couldn't ignore it any longer. Her doctor confirmed her worst fear. Irma was dealing with early-stage colon cancer. Too many seniors make the same mistake Irma did, ignoring symptoms out of embarrassment. But by the time they go to the doctor, the condition has advanced, and their options are limited. Here's the thing, changes in your bowel habits don't just signal aging. They signal a problem that your body is struggling to address. Blood in the stool could be a sign of colon cancer, which is one of the most common cancers among seniors. Thin stools, often described as pencil-like, can be a sign of something blocking your colon, while persistent constipation or diarrhea can point to GI issues or infections. If you're experiencing any of these symptoms, don't wait. Too many people, especially seniors, wait until it's too late because they're embarrassed. They think it's something they should just live with. Would you rather be uncomfortable for 5 minutes, having a quick conversation with your doctor, or face a lifelong regret? The choice is yours, and early detection can save your life. So, the next time you notice a change in your bowel habits, don't ignore it. Take action. It can make all the difference in your health moving forward. Irma's story could have had a different ending, if she had acted on the signs. If she had taken those subtle warning signals seriously, her journey could have been much different. But that's the reality we face. Too many of us dismiss the body's signs until it's too late. The truth is, your body is always speaking to you. Every symptom is a conversation you can't afford to ignore. Ignoring it might silence you permanently, and you don't want to be caught on the other side of that. The good news is, awareness is power. By recognizing the warning signs, you can take control. You don't have to wait for your health to spiral into something irreversible. You can take action now, and that could make all the difference. It's easy to feel like these things are just part of getting older. But aging doesn't have to mean ignoring the red flags. It's about understanding your body, and choosing to act when something feels off. You've earned this life. You worked hard, you've built memories, and you deserve to live it to the fullest. Don't let ignorance steal it from you. If this video made you think twice, imagine who else it could help. There's someone out there who might be ignoring their own warning signs, not realizing the gravity of it. By sharing this video, you could save a life, maybe even someone you love. So, hit that like button, share it with a friend or family member, and don't forget to subscribe for more life-saving tips every week. Remember, your health matters. Take action today, because tomorrow might be too late.